Hi, Dr. Brian McGee, physical therapist with Exercise. Today I want to talk about Achilles tendonitis, or more correctly termed Achilles tendinopathy. So why the name change? Well, tendonitis would imply that the tendon is inflamed. And in fact, in the vast majority of cases, the tendon isn't inflamed. And so treatments that are aimed at decreasing inflammation, like massage, stretching, ice, anti-inflammatory medications, might give some temporary relief, but really don't impart any long-term or even intermediate-term benefit. So what does work? What really works for Achilles tendinopathy is a super gradual progression of tendon loading, otherwise known as strengthening. And what this seems to do, if done very gradually and kind of strategically, is it can help decrease pain, but more importantly, it actually stimulates healing within the tendon itself, remodeling of the tendon tissue. And so what I'm going to go through today is my 3-phase program for Achilles tendinopathy. The first phase of the program we call the symptom management and load reduction phase. So why does the Achilles get irritated? You're simply applying too much load to it, too much physical stress to it over too little time. The tendon can't adapt fast enough. So in this first phase, we've got to decrease that load to give it a chance to heal a bit. So does that mean you can't do anything? No, and in fact, doing nothing might actually be detrimental. So then the question is, well, how much is too much? Here's the guidance I give my patients. I say, number one, your pain with whatever the activity is, your workout program, your sport, or the rehab, shouldn't exceed 5 out of 10. Now, what exactly does that mean? How can we give some more specific guidance to that? What I tell my patients is 5 out of 10 is when you feel you need to take medication to manage your pain. So if you hit that point, whatever activity you're doing is too much. You got to back down a bit. The other thing we want to start in this stage is that very gradual progression of tendon loading that I mentioned in the intro. We want to start to do a little bit of strengthening for 2 reasons. Number one, gentle strengthening within these pain parameters that I mentioned can actually decrease pain, which seems counterintuitive, but it works quite well. So number one, we want to decrease pain. Number two, we want to start to stimulate actual healing within the tendon itself, and strengthening helps us do that. So our first exercise is a simple heel raise on flat ground, on a flat floor, okay? So using something for balance, you're simply going to raise up on 2 feet, right? So the unhurt side can help the hurt side a little bit. Slow up, 3 seconds up, 3 seconds down. Up, 1, 2, 3, down, 1, 2, 3. The slow part of it, that time under tension for the tendon, seems to be one of the magic ingredients to getting that tendon to start to heal. So go for about 3 sets of 15 to 20 repetitions with this exercise. Our other exercise in this phase is isometric strengthening of the Achilles. So isometric just means there's tension going through the muscle and tendon, but there's no movement. So we're going to take a weight, put it on your knee. So I have a 20-pound weight. That'll be about right for most people, but you can use some trial and error to find a weight that will work for you. Simply raise the heel up with the weight on the knee and hold this for 45 seconds, which is an awfully long time to hold, it seems like. So you'll want to skew on the lighter end with the weight. What we're trying to do here, twofold. Number one, counterintuitively, this often helps decrease people's pain in the short and intermediate term. Number two, back to what I had mentioned before, we're actually trying to load the tendon a little bit to stimulate healing and remodeling of the tendon itself. So again, you're going to go for about a 45-second hold, 3 to 5 times per day. Now notice what we're not doing in this initial stage, this load management, symptom management stage. I really don't like to have my patients do a lot of massage to the tendon, and specifically not cross-friction massage, which has been used for a long time, was popular for a while, but really doesn't tend to work very well. And mechanically, it kind of makes sense that it doesn't work very well. Tendons are like ropes. They're great in tension. You can pull on tendons like crazy. They're not very good with shear force or force across the fibers of the tendon. And that's what cross-friction massage is. Tendons don't adapt to that well. And as a result, I really don't use it with my Achilles tendinopathy patients. The other thing we're not doing is a lot of stretching. Now, stretching doesn't seem to be bad or detrimental to patients, but it doesn't seem to help. And so I generally steer away from it. If it gives you some temporary relief, that's probably okay, but stretching shouldn't be a hallmark of the program. Now we're moving on to the next phase, phase 2. We call this the recovery phase. So we were in the symptom reduction load management phase for about a week to 2. Depending on progress, we move on to the recovery phase, this phase. The hallmark of this phase is we're simply gradually ramping up our strengthening of the Achilles tendon to both, again, decrease pain and to stimulate remodeling and healing of the tendon itself. So our first exercise, back to the weight on the knee. Instead of keeping the ankle still with an isometric contraction like we did in the prior phase, now you're simply going to do a calf raise, okay? Now, one of the key points, slow movement. Time under tension seems to be one of the magic ingredients in stimulating some healing in the tendon. So 3 seconds up, 3 seconds down, 3 seconds up, 3 seconds down, okay? Now you'll want to choose a weight that allows you to get to somewhere around 15 repetitions, 3 sets of 15 repetitions once a day with this exercise. Now also notice all of the exercises we're going to do, I'm doing on a flat surface. The reason we're doing that is there's generally 2 types of Achilles tendinopathy. Insertional, at the tip of the tendon where it attaches to the heel bone, and mid-substance, about 2 inches up from that point. So the folks with the insertional Achilles tendinopathy tend not to like heel raises where the heel falls below the horizontal. So I'm simply avoiding that in this program so we can sort of appeal to a bit of a wider audience, okay? Again, the key here, a fairly heavy load, minding our pain management parameters that I talked about, and slow movement. The next exercise is simply a standing weighted heel raise, okay? So raising up and down, again, keeping it slow, like I mentioned before. Choose a weight that gets you a little bit tired at that 3 sets of 15 reps range. Now, if this is pretty easy for you, if it's not getting you beyond our pain management parameters, you can switch to single leg as well. Now you might need something for balance, that's fine, but you'll want to progress to the single leg version at some point in this stage. Our last exercise for this phase is a balance progression. I often tease with patients that balance training to me is kind of like Frank's Red Hot. I put that shit on everything. Now, does balance training specifically help the Achilles, or is it proven to help the Achilles? Not that I'm aware of, but our end goal is to get back to some function, some sport, maybe a job, a workout program, which will undoubtedly require some balance. So I think this is a logical time in the progression to address that. So simply balance on your hurt side. See if you can go 30 seconds or so. Kind of a convenient way I have patients do this at home is I just instruct them to balance while they're brushing their teeth, which actually is quite a long time to balance. It gets quite tiring. The other thing you can do is roll this into a partial squat, which really does load the tendon, not unlike our calf raises. So I call this the bowler squat. It looks a little bit like you're bowling, and you just try to squat up and down 10 to 15 times. Our last phase of the program we call the rebuilding phase. So we were in that recovery phase for somewhere around 4 to 6 weeks, again, depending on progression. And we'll be in this phase for 6, maybe 12 weeks. It can really take a long time to get the Achilles tendon to heal. So what are we doing in this phase? We're continuing the exercises from the recovery phase, but we're going to go down in frequency 2 to 3 times per week. We're going to go up in intensity, right? We've gradually continued to increase our weight with some of the exercises, and we're going to add a few to, number one, again, stimulate more healing and remodeling in the tendon, and to get back to a function of the tendon that is more like real life, more like in a sport, in running, in a workout. So our first exercise we call an eccentric heel raise. So you'll want something for balance. You're going to come up on both feet, shift weight to the hurt side, and try to come down slowly. Back to both feet, up with both, shift weight to hurt, pause for a moment at the top, come down slowly. See if you can do 3 sets of 15 of this. Choose a weight that allows you to get to about that training volume, okay? The last exercise in our progression is what we call plyometrics, or jump training. Now, the purpose of this is to help us transition from this very gradual strengthening progression to some real-world activity, like a sport, like jogging, probably whatever activity initially irritated your Achilles tendon. The other thing we're trying to do is continue to strengthen the tendon. This type of exercise actually strengthens the tendon quite a bit, so long as we don't overload it. So here's how we start. Simply a rapid 2-leg heel raise, okay? So once you can do about 50 of these without exceeding the pain management parameters we specified, add a little jump, okay? Once you can do about 50 of these, then start to add some directional change. A little jump forward back, a little jump side to side. Once you can do those without exceeding our pain management guidelines, then you do single leg. And once you can do 25 of these in multiple directions and straight up and down, then we transition back into whatever it is you love to do. That's my 3-phase program for Achilles tendinopathy. I hope this helps you get back to what you love to do. Like, subscribe, leave a comment, and we'll see you in the next video.